So that's part of the problem. I think people don't realize that between federal and state dollars, we already invest almost $200 million into children's mental health. But what the problem is, or part of the problem is, our parents don't know where to even begin to start to access the services. Now, I'm not saying that it's not going to take additional services, but there's a great deal of money that's already going into the system, and we just need to make sure. So with a structure and with a system, it will help parents know where to begin and how to start to access some of the services that we have. The 24/7 hotline and just other components of it, I think, will help start to help parents and families and educators be aware of what the services are. We were able to, I asked for money to buy down the wait list for the children's mental health. We were able to do that this year, and then additional money to help educate our teachers so that they can start to identify some early warning signs, which they are so appreciative of that. They want to help, they want to be a part of the solution. And even they were saying, with the teachers cabinet that I have, they don't know where to go to help these parents, and they feel so helpless. So by putting a system together and talking about who's eligible and then mandating core services, that will help us start to identify again where the gaps are and what we need to do differently, and then what additional funding needs to take place to make sure that it's sustainable for the long road.
So will the Children's Mental Health Advisory Council that was created to then recommend to you what they thought would be most valuable in a children's mental health system, is that who will then be deciding or recommending what changes need to be made or where the funding stream needs to come in, or who will make that?
So the boards will be a part of that. They will help us determine what we need to do. It's just like we did with the adult mental health system. It was a county by county. It went to a regional. There still were barriers. We had a task force that came together. They identified what those were, and then we came back the year before last year and made significant changes that addressed the barriers. And so we still need to take a look at funding for that as well. We did this year, we extended the buy-down period and increased the carryover percentage. But both of those systems, we need to take a look at what we need to do from a sustainability perspective moving forward. And so the boards are separate, but they align. So we've got, and they should. At some point, I can see them almost being one system. And so it'll be the individual groups that'll help us weigh in, working with the Department of Health and Human Services to determine what that looks like.